Hi everyone, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about natural solutions for headaches and also migraines. Now this is a very common thing that I see in practice. Over 30 years of practicing, I've had literally thousands of patients come in with headaches, all different kinds, migraines, which are severe headaches, often with nausea, vomiting, sensitivity to light, auras, and really debilitating to the point where you feel like you can't work or go to school or exercise or function at any level. And over almost 20% of the population will have migraines at some point, and over 50% of Americans have headaches. So it's a really common occurrence. And what caused me to start to talk about it this week was that a patient come in who had migraines for 3 years and was in and out of the emergency room 3 times a year, was admitted this last time, all kinds of tests. She's been on heavy-duty medication, anti-seizure medicine, and then was going to a neurologist, and they were doing Botox injections, every 3 months. So, I mean, if that's, some people are more inclined to doing that and they're okay with that. That's fine. It can give symptom relief. However, if you want your headaches cleared up once and for all, there are some specific causes and specific solutions for these that we'll go over today. So, number one are food sensitivities / allergies. This is a very common cause of headaches, and it reminds me of a patient I had in her 50s who came in a while ago who had migraines for many, many years, nausea, vomiting, fainting spells with these, would also end up in the emergency room, went by ambulance one time, the latest time, where she had passed out. So this was really debilitating to her, and after doing an evaluation and lab test, put her on a diet I call the free diet, which is free of all the common allergens. So there's 2 ways basically to address food sensitivities / allergies. One, you can do food testing, blood testing for hundreds of different foods to figure out what you're sensitive to, and another way is through diet. And again, I call it the free diet because it's free of all the most common allergens. So over the 30 years of ordering food sensitivity testing, I've come up with the most common foods that keep coming up over and over and over again. So that's what the free diet is about. So she went on that diet and also was getting treatment, and her migraines cleared up that she's had for years within the first month. Her regular headaches, which she was getting very often, and her migraines both cleared up within a month's time, and she had these for years. So now, going on months later, or actually almost a year later, she was out. Now, she had been free of headaches this whole time. She was out and was really hungry. It was a Friday afternoon, so she stopped in a fast food chicken place. Next morning, Saturday morning, woke up debilitating migraine, nausea, lightheadedness, fatigue. I mean, she had to call in sick from work the whole weekend. Came in Monday and were able to help her out and get that cleared up. But in her case, her trigger foods, after going through the free diet, phase 1 and then phase 2, adding foods back in. After going through that, we found her trigger foods were mainly gluten and yeast. So just something as simple as that can literally trigger a migraine. And if you would like as a courtesy, I'm going to provide a copy for you of the free diet phase 1. So if you want to click on the link below, we'd be happy to send that to you. So secondly, a second common cause of headaches, migraines, are nutritional deficiencies. So some common ones I see are iron deficiencies, magnesium, with relating to migraines, vitamin D, and regular headaches. So I had a patient actually who was 10 years old. A patient brought her daughter in. She was having headaches, fatigue, mood swings, lack of focus. And after evaluating her, she ended up having an iron deficiency. So after improving her diet and getting on an iron supplement and some other of our natural medicine formulas, she cleared up, and her headaches cleared up, and her focus improved, and her energy came back. So in her case, it was more specifically nutritional deficiencies that were the issue. And whenever she would run out of iron and not take it for a while, her symptoms would come back. And thirdly, we have structural abnormalities or physical stress that are a huge cause of headaches. And two components of that: there's a muscular component. So if you can have knots or trigger points, we call them myofascial trigger points, which are basically tight bands within the muscle, and you can get them in your shoulders, your occiput, back here, TMJ. There's muscles all in your jaw. Even in your head, there are muscles. So by these trigger points or tight bands or knots within your muscles, that can radiate pain up into your head and cause headaches. So, and secondly, in your neck, your cervical spine, if the vertebrae are fixated, irritated, locked out of their normal alignment, that can irritate nerves that go up into your head, and that can cause headaches, all kinds of headaches, migraines. So by getting those addressed and treated, which I'll go over in a second, that can clear up headaches. And as far as what causes that, so one are accidents. Car accidents are a common thing. Like recently had a woman in her early 20s come in who had been in a car accident about a year ago, and so she was rear-ended. A week later is when this a migraine started, and she never had it before. So she had a migraine with dizziness, migraine with vertigo actually, which persisted, nausea, and this has been going on since then. So she came in recently, and within a couple of treatments, her migraines went away. So she no longer has migraines or regular daily headaches. That cleared up. And that was from a whiplash injury. So basically after doing the evaluation, taking x-rays, found out where the problem was and treated that accordingly. And other possible causes of structural physical stress or sports injuries. And another patient, actually who was in high school from playing soccer, injured her neck. She didn't really realize it, but just over and over and over again of hitting the ball and having like whiplash injuries, micro whiplash, I call them, over and over and over again. She developed migraines and came in, again, evaluation, x-rays, found out specifically what was going on and did the treatment. And we use a specific instrument to adjust the spine. Like, I know a lot of people are kind of afraid to get their neck cracked, which I don't, so I'm not saying go right out and get your neck cracked, if, because that can be a bit much for people to handle. So I like using, we have a computerized instrument adjustment called an impulse. So that's something you might want to consider looking for if you're going to go and get an evaluation for that. And then the muscle work, this patient I was just talking to, she had massage, actually been to another chiropractor, and wasn't getting any better. So massage is great, but as far as specific trigger point therapy, you want really specific treatment, myofascial release, active release, trigger point therapy to release these very specific knots, whether it's in your occiput, your neck, your jaw, any of those areas, and that can offer tremendous release and actually clear up. I'm not talking about just symptom relief. I'm talking about actually clearing up headaches by addressing the root cause. And posture is another main thing. So, sitting, being on your phone, sitting, standing, walking, whatever, on the phone, looking down, on the computer, studying, reading. So all that puts a lot of stress that over time can cause what we call cumulative trauma. So it's not like a whiplash injury, but it's over time can cause the muscles to tighten up, the vertebra in the spine to get really restricted. Again, nerve irritation, referred pain. So that's something that you really need to be aware of. And one of the things we do with our patients is, besides the muscle work and instrument adjusting, we put them through postural functional training exercises to improve their posture and really relieve that stress. And again, and they continue that on their own. So once they're better, they can continue to prevent that, from coming back. So that's a huge issue. And lastly, just mention braces. So I had 2 patients a while ago in high school that each of them actually had braces, and both developed migraines sometime after getting braces because that caused shifting in their jaw and TMJ issues. So with treating their TMJ, the neck, the muscles, the joints, and going over the functional training posture exercises, we're able to get those headaches, migraines completely cleared up. So again, if you look to addressing the root cause and get specific treatment, whether it's diet, supplements, manual therapy, to get these cleared up, you actually can resolve your headaches, your migraines, and absolutely get better. It's not something you have to live with injections and medication and emergency room visits and all that if you choose not to. So if you have any questions on that, any comments, feel free to comment below. And if you want a copy of the free diet, again, you can click on the link. If you want to check out our magnesium supplements. So magnesium is one of those supplements that even that has been shown to be really helpful for headaches, and it's very difficult, very challenging for most medical doctors to recommend any supplements, but even many neurologists have come around and recommended magnesium because that's been shown to be helpful for migraines and other headaches. So that's one of the most common things when I do lab testing that I find is low in almost everyone we test, and that acts like a natural muscle relaxer, really helping relieve tension, and that can be great for headaches as well. So once again, thanks for joining me today, and if you have any questions, let me know. Look forward to seeing you next time. Take care.